grant titled "The Role of Civil Society Organizations and the Private Sector in Filling Gaps in the Delivery of Services Not Provided by the Government." The objective of the grant was to map and analyze the roles of civil society organizations and the private sector in Iraq and Jordan in filling the gaps in the delivery of local public services that should otherwise be provided by the government. The study demonstrates the challenges faced by civil society and the private sector in providing such services through a comparative study in the two countries. The research was conducted in 3 different localities within each country. In Jordan, it was conducted in Amman, Zarqa, Al-Baqa refugee camp, and in Iraq, the 3 areas were Erbil, Kirkuk, and Sulaymaniyah. The research study is a collaborative work between the Academy for International Development Middle East, AIDME in Egypt, and Al-Badeel Center for Studies and Research in Jordan, and Inmaa Organization for Development in Iraq. The webinar will take 1 hour, 45 minutes for speakers, and 15 minutes for questions. I will now leave the floor to the research team. We will start with Mr. Ahmed Abdelhamid. The floor is yours.
Hello everybody, can you hear me well? Well, first, on behalf of AIDME, I would like to take this opportunity and thank all our colleagues and partner, Al-Badeel Organization Research Center in Jordan and Inmaa in Iraq. I would like to thank them for the great effort that they did. Unfortunately, some of them didn't have the time to join the webinar, but their effort were very significant for this research. I would like to thank as well RBCD team, especially Mr. Salah Rashidi, for the support and technical support he has provided during this research. And finally, I would like to thank USAID and RBCD management for giving us the opportunity to do such a research. First of all, the team conducted the research using a highly participatory approach. We use the participatory action research tool. Part of this research was desktop research. We made a literature review nationally and internationally and regionally to have more information about the situation of service delivery in both countries and especially in the research target area. And after this, we did a secondary resource analysis, including reports, statistics, strategies, and more into organizational profile and policy analysis. In each country, 12 interviews were conducted with policy makers, with executive, and with the community leaders, and 12 focus group discussion have been conducted as well. Different research tools have been used. Adding to the focus group discussion, we use the mapping and ranking and different methodologies. As a start, it was very important for all the team. Ask Mr. Salah, can you hear me now? Okay. Well, as a start, it was very important for the team to work together and unify the terminologies. So we conduct a training session in each country. During this training, we discuss the participatory action research, different participatory action research tools, and we develop the research plan. Then each team start working individually. Yes. Do we have a problem in sound? Please confirm. Well, after finalizing the concept and methodology workshop, we start in the data collection phase. We start with the data collection phase. Each country worked individually to collect the data with close coaching from the research lead and the national research coordinator. After this, we combined the two researchers together in a comparison study. So now, by the end of the research, we have three reports, and we are willing to share the reports, the results with you, because we have report for Iraq and we have separate report for Jordan. In addition, we have the comparative studies between both countries. I will leave the floor now to our colleague Magdi Al-Korom. Oh, before handing the presentation to Magdi, the last phase of the project was dissemination of the information. So we made a conference in Al-Badeel Center for Studies, made a conference to disseminate the information in Jordan, while in Iraq for a security reason, because the tense of security situation, because during this time some security incidents happened in Kurdistan region, so it was very important not to get the people together. So the dissemination for information for Iraq made by distributing the final copy of Iraq report. I'm handing now the presentation to Jordan. Dr. Magdi Al-Korom and Dr. Jamal will give us slightly information about the finding of Jordan.
Hello, everybody. Greeting from Jordan. I have with me Dr. Jamal. He's the Al-Badeel director, and he was one of the main researchers in the study. Let me give you a brief summary of the research finding for Jordan. Jordan study included civil society organization, government sector, and the private sector as the other country, as in Iraq, working in the provision of public services, including health, education services, as well as service recipients in the areas of Amman, Zarqa, and the Baqa Palestinian refugee camp. One of the major results in the research was that civil society organizations are still working in the field of awareness more than anything else, and limited to providing health and education services through only small projects within also a limited geographical coverage, especially in rural areas. The private sector, on the other hand, provides all the types of health and educational services. The research shows that there is a weakness in the provision of support services in the field of mental health and social services, and for the special needs in the civil society organization. The private sector, on the other hand, and the government as well. The research further revealed a defect in the structure and organizational strength in the civil society organization, despite the presence of qualified manpower. The level of service quality also vary between the three research areas. In Amman or the more urban areas, the services was much better. The civil society or institutions face financial challenges in terms of its ability to attract multiple sources of funding and the provision of sustainable projects, which affect their ability to provide such services in the future. The private sector, on the other hand, provide a good services, but still at very high cost, which more and more people cannot really afford. The research shows weaknesses in the relationship between the government and civil society organization and the private sector, all the three sectors, which loses the ability to influence public policy. We see a lot of meetings between the three sectors, but never been taken any action, real action taken. Among the major recommendations, there is a need to build an umbrella of civil society organization in partnership with the private sector and the government. The three of these sectors have to establish some sort of an umbrella to be able to work better and work to unify efforts in the management of public services among all sectors. The recommendation of service providers and beneficiaries centered around the need to expand and standardize health insurance network and give mental health services adequate attention. In the area of educational services, the service providers and beneficiaries suggested the establishment of joint institution between the Chamber of Industry and the Commerce and the Ministry of Higher Education to qualify university graduates to the requirement of the labor market. We have a problem in really between the demand and supply in the labor market, and nothing has been done about that. The study also called to amend the plan to develop a model of partnership between public sector and the civil society organization and work to create fund or endowment to finance the activities of civil society organization, so to avoid the dependence on external resources which keep the civil society organization always fragile and unsustainable. Sorry, I was fat, but that's the major finding of the Jordan research. I hope you have more questions, and me and Dr. Jamal will be happy to answer. Thank you, everybody. I will leave the floor now to whom to speak.
Hello.
Hello, is that fine, Ahmed?
Yes, I would like to ask Salah to assign us as a presenter again, please.
Sorry, I couldn't hear you, Ahmed. You want me to do that again?
Yes, you are a presenter. Ahmed, you are a presenter.
Okay, okay.
Isn't there a problem? And Dr. Magdi, could you please mute your mic?
Sure, thank you.
Thank you so much, Dr. Magdi. Ahmed, are you facing any problem?
Yes, would you please, because we will use another computer, so can you put Muhammad Abdul Wahid as a presenter, and we will proceed as a presenter after Majdi
Okay.
Kolom
Okay.
complete his presentation.
Now he is a presenter. Muhammad Abdul Wahid is a presenter now. You can proceed.
Salah, we are ready. Do you want us to proceed with the
Iraq,
Kurdistan
Kurdistan
findings?
research funds. Yes, exactly.
Okay.
Yeah,
Thank you.
hello everyone. Today I'm talking about Kurdistan research findings. The research study has been conducted in 3 different areas in Kurdistan region in order to identify the role of civil society organization and the private sector in filling the gaps in the provision of public services not provided by the government. So in the health sector, according to the interviews that have been conducted with the health service providers and recipients, there were no significant changes or development in the health sector. The number of hospitals did not increase in parallel with the population density or the large number of migrants and refugees coming from central and south provinces as a result of the political instability in Iraq since 2003. So the main findings are including the majority of citizens turn to the private sector in health services provision due to the incapability of the government sector to fill the citizens' medical needs. Therefore, the private sector seems to be competing with the government sector in filling the gaps in health services provision, despite its high cost. There is a decline in the contribution of CSOs to participate in the provision of health services, which require more efforts to activate its role. In the government sector, there is an effective participation in health service provision, and its fees are low, but the service provided are not in good quality. However, the private sector, there is effective participation in health service provision and services are in good quality, but there is a big interest in profit gain and thus services are costly. In the CSOs, there is an ineffective participation in health service provision, but the service provided are in good quality with low fees and sometimes even free of charge. In Erbil and Salmaniya, the government sector occupies the first stage where it participates in health services provision by 50%, while in the private sector, it occupies the participate in health service provision by 48%. On the other side, the CSO's participation in health service provision does not exceed 2%. While in Kirkuk, the private sector occupies the first stage, it participates by 60%. The government sector occupies the second stage, where it participates by 39%. And last comes the CSOs participating by 1% only. I'll move on now to the second sector, which is the education sector. And the private sector both are providing education services in all education levels, from kindergarten to postgraduate studies. However, the CSOs do not provide education service, but some institutions provide language and computer courses only with standard fees. According to the data analysis, the main findings are as follows. In the government sector, education service is free of charge, but not sufficient to be relied upon, as it's not in good quality. Education service is provided to all citizens, which has negative impacts on the quality of services. While in the private sector, education service did not exist before the fall of Saddam regime, except the university level, and thus it's not highly qualified or experienced. However, there is an effective participation in education service provision, and services are in very good quality due to the availability of financial possibilities. In terms of the service fees, they are very costly, where middle and lower class cannot afford, and thus they are not benefited from such services. In the CSOs, there is an ineffective participation in education service provision, but the service provided are in good quality with low fees and sometimes even free of charge. The government sector occupies the first stage in education service provision in the three areas of the research studies, Erbil, Salmaniya, and Kirkuk, where it participates by 85%, while the private sector occupies the second stage, and the CSOs are always at the last stage due to their limited role in providing education services. Finally, I would like to explain that there are 6 obstacles facing the private sector and the CSOs in providing education and health services, which are financial problems, legal problems, lack of equipment, lack of facilities, lack of experience, and finally corruption. Thanks for listening.
Hello everyone, I'm Ahmed Al-Assal, one of the research team working on the comparative study. I will present the comparative study in both sectors, health and education. Firstly, the research study investigates the role of the civil society and private sector in delivering public services in education and health in both Jordan and Iraq. Government on different levels and with different qualities, and putting in the consideration the political and demographic factors in both countries. Now we will start with the main findings of the comparative study in the post sectors. First, we will see that the low quality of the public services provided by the civil society and the private sectors at Kirkuk in Iraq and Al-Zafra in Jordan due to the high population density. The second point is the private sector and the civil society organizations are still limited to certain health services in both countries. The services provided by the government in the health and the education sectors are affordable in terms of price compared to the service offered by the private sector and the civil society organizations when we are comparing between the price and the quality. Also, the financial obstacles, in addition to the current laws, the current laws by the private sectors, in terms of the obstacles facing the CSOs and private sector organizations in filling in the gaps of the government in providing the public services, the lack of qualified cadres in health sectors, in addition to the prevalence of corruption cases in the governmental sectors, are other significant obstacles that hinder the role of the CSOs and the private sector organizations in filling in the gaps. On the other hand, the study in Jordan pointed to the increasing pressure on the Jordanian citizens in reaching the benefit from the public services offered by the CSOs and the private sectors due to the increasing the number of the Syrian refugees, as mentioned from the beneficiaries of the studies. Also, with regarding to the nature and the size of the role of both private sectors and civil society organizations in both education services provision, the research finding pointed to the fact that activities of most of CSOs in both countries are limited to the raising awareness or the training or reducing illiteracy rates and providing basic education needs to public in the primary stage, as my colleague presented in the last presentation. Also, the Jordan differed considerably from Iraq in terms of the size of the role of CS sectors in providing the educational service in Iraq, and the role of the private sector in weekend delivery satisfaction educational service for example, in Jordan. On the other hand, the private sector serves more than 32% of students along different education stages. And now we will present a summary of the comparative study between Jordan and Iraq in the health sector. The graph below summarizes the comparative analysis of the health sector in Iraq and Jordan, highlighting the most important findings and also which is they both share according to the collected data from the interviews. Some of these findings are not only limited to one country, it may exist in the other country but was not stressed on by the interviewees, such as the social corporate responsibility. For example, in Jordan, we will figure out in the right side. On the other hand, the corruption in Iraq, and the intersection part between the two countries is the most highlighted part from the two sides, and the intersection. The other, the other graph, the other graph summarized the findings of the comparative study in both Jordan and Iraq in the education sectors. For example, we will find that the economical accessibility is one of the obstacles in Jordan, and in the other hand, the poor of the infrastructure is the most highlighted point in Iraq, and the same for the intersection area between the two countries, the parts held by the interviews. Now, I will let the floor for my colleague Dr. Salah Abdelrazek to present the comparative study findings in the public policies.
Okay, good evening, everybody. I hope that you're still connected. In this part of the study, we discuss public policies and the involvement of social societies in both countries, also to identify similarity and differences between them, as well as potential for enhancement of NGOs and the role of social societies organization and private sector in services provision, as well as recommendation to enhance identified potential for enhancement. If we start with Jordan, in Jordan we identified about more than 3,000 civil society organizations covering 4 subgroups were identified: grassroots, local community-based organization, national NGOs, umbrella organization, and platforms. Civil society organizations is governed by a law and societies and social bodies. NGOs are CSOs registered with a semi-governmental organization, and because they are not considered as a department of the ministry. Main challenges we spotted here based on the interviews: inadequate funding, lack of coordination, fragmentation of services, competition, lack of productive working environment. Most of involved government departments do not have requisite skills and capacity of efficiency addresses social development issues. Lack of coordination between various governmental agencies of same concerns. Advocacy of public policies and regulation are limited. No effective partnerships among stakeholders, governments, development partners, and civil society organizations. In Iraq, the number of NGOs is somewhere between 8,000 and 12,000 NGOs were registered within the years following the invasion. The law of non-government organization number 12 was into effect on April 7. Subsequently, the law of non-governmental organization in Iraq Kurdistan was approved on April 6, 2011. NGOs Registration Bureau are federal government NGOs Directorate and Kurdistan Regional Government NGOs Department. The main challenge facing NGOs in Iraq, the internal and transparency of NGOs is organizations should communicate the result as well as their failure to the public. CSOs should take all steps available to prevent political interference. CSOs should branch out, expand their efforts, and work with the many groups and parties as possible, and ensuring that the activities of civil society sector reflect the need of the people. Difficulty accessing central government officials, particularly elected representatives. CSOs are having difficulties in getting their message out. Now we will discuss similarity of both between both countries. The dominance of religious and culture is largely rooted in both countries. Freedoms of NGOs remain under strict control, but in relative percentage. Both countries have characteristics, prosperities. They aims to support the call for democracy by supporting civil society organization to push the programs of increasing the answers of people. The civil society organization influence or role in public policy reform in both countries is limited. The determinants of the relationship between the civil society and the state are relatively the same in both countries. A major challenge that faces countries in terms of inadequate funding, lack of coordination, fragmentation of service, competition, and lack of productive working environment are similar in both countries. If we went to the differences, the issues defined by the civil society organization in Iraq were more related to political aspects, as human rights, women empowerment, and fighting corruption. While most of the organizations in Jordan are concerned with helping the poor and struggling for minority rights and community service. The economic situation of Jordan and Iraq Kurdistan is different accordingly that affects the state power over CSOs. The number of civil society associations in Iraq is much higher than Jordan. Consequently, their role is spotted to be more effective. The Women Civil Society Organization is playing a crucial role in women empowerment, either politically or social in Jordan, where the women in some areas in Iraq are totally oppressed. However, political system in Kurdistan is more open and independent. The legal framework that allows the civil society organization to work freely is more restricted in Jordan than Iraq. Potential for enhancement for both countries. Revising the legislative framework that civil society organization works through toward giving this association more freedom. Preserving the civil society independence in front of the state by giving them the freedom to search for non-governmental funds or purposes. Involving the civil society in the policy-making process through giving them the chance to initiate the needed policies to solve the different problems. Building the civil society capabilities and this association should work to develop its own resources. Civil society organizations should have a mission and vision that they would work through. Decreasing the gaps with their community, where the civil society organization work through and building a trust bridge with people. Finally, we will about the recommendation. The major recommendation here is the government needs to pay more attention to strengthening participatory concept in both countries to build the civil democracy, human society in order to provide equal opportunities. Legal environment, we need to implement the current laws to build a civic democratic society and to achieve CSO sustainable development. While information environment, government should implement and improve the legal environment for public access to information. Cooperation with CSOs to provide CSOs with free venues of central and local government conference and seminar facility when CSOs organize activities of public interest. Funding agencies, we mentioned the donors, need to recognize real contribution of CSOs made for development effectiveness in their countries and to improve their cooperation with CSOs and to implement their promises and commitments towards civil societies. Thank you very much.
Well, before starting, hello.
Ahmed, do you have anything to say?
Yes, I think it was very crucial to start a new research because from the field work we figured out it's very difficult for the people, for the communities to know what type of services that the country should provide or shouldn't, you know. So we had a long debate. Yes, everybody, can you hear me?
Yes, we can hear you.
Well, it was important to know what type of services that the government with the communities are agreed to provide such services, because it wasn't clear at all for the local communities what is the basic services that the government should provide or not. So they put all type of services, a lot of burdens on the government, even for some services that, well, the government itself didn't commit itself to provide such services. And I think this will be the new research that AIDME will take the opportunity to do in the future. Thank you for your time, and we are sorry for the technical issues that we are faced in the connection, and we are open to have your questions.
I'd like to thank all the speakers for the very informative and great presentation. And yes, we can move directly to questions. If anyone has any question, please press the red flag above the chat box, or just write the question in the chat box itself. You can't hear me?
Yes.
So I'm just waiting for someone to ask a question. So we'll be waiting for someone to press the red flag. So I see we have a question from Dr. Majdi Al-Kurum. You can, the floor is yours, Dr. Majdi.
Thank you very much. It's actually it's not. It's a more a comment than a question, because one of the unique aspects of this research is that we will find out that the amount of research done on the coordination between the three sectors, the private sector, the government, and the civil society, was really in short. We hope that we build on that fact. We found out that there is a lot of research related to the civil society organization, a lot of research related to the government sector and the service provision. The private sector really lack research, and we probably have to build up the fact that there is no much research related to the coordination between the three sectors. And that was a major finding. Everybody was saying that one of the best booster of the services is to have a coordination between the three sectors. So I don't know if Iraq faced a similar situation or not, but in Jordan we definitely need to work out on the more coordination between the sectors. Thank you.
Thank you, Dr. Majdi. Yes, you're totally right. The coordination is the key word for to get better outcomes. So, any other question? Okay, Mr. Ahmed. Mr. Ahmed, you have the floor.
You can start again. Well, I hear Dr. Majdi Al point, and I do agree for enhancing the links and the coordination between the three sectors. But it's important to have such a coordination in a legal framework. And we can start piloting in some services, and I think this is part of what the governance system should consider. It was more enhanced in Kurdistan region because of the population number, and its region. They have a lot of resources, and the region itself is booming, especially in a construction and the basic infrastructure. So from the governance point of view, we need to have sort of a legal framework to enhance.
Mr. Ahmed, you're disconnected. So obviously, Mr. Ahmed got disconnected. So any other? We've heard, yes, what you said, but you got disconnected in the middle. So any other question or comment? So, okay, I would like to again thank you all for. Are you back, Mr. Ahmed?
Yes, Salah.
Mr. Ahmed?
Do you want me to
Yes, we
repeat what
can
I
hear you
said
now.
again?
Yes, please.
Well, I did hear Dr. Majdi point, and we do agree. But comparing, because we are comparing between Kurdistan region and Jordan as a country. So the level of institutionalized and has a very clear
Again, I'm sorry you got disconnected. So unfortunately, we will have to put an end to. Yes, okay, no problem. Thank you all for participating, and I'd like again to thank the speakers. And I hope you benefited from this webinar. And all of you have a good day. Thank you all.